talk about these contouring surgeries, Pave, because people need to understand, like, these are not small surgeries.
No, sir. No, they're not.
They can be quite extensive. There's blood loss involved. These are major surgeries. These are not surgeries. These are reconstructive surgeries. I want you to understand that people who are watching this, you need to understand these are reconstructive surgeries, very powerful transformation surgeries, but they do carry risk. I'm gonna tell you now, like, there are surgeons that will like do all body parts at one time.
Right.
And that is, can I do the surgeon? Absolutely. For me, ethically, I will never do that.
And
it will never happen in my hands. I know what my limit is, and I'm willing to tolerate, not for me physically as a surgeon, but it's really what I feel is safe for who I would put to sleep as a family member, which for me is a surgical amount of anesthesia time, and in my hands is 7 hours.
Yeah.
So I can do a lot in 7 hours. I really can do quite a bit, but you have to consider the risk of anesthesia and then also blood loss.
Yeah.
And so, having surgery in a accredited facility that can handle emergency situations, whether it be in a hospital or a private surgery center that maybe can have overnight capacity to watch you for observation and fluid hydration afterwards. But I'm telling you, Pate, man, I hear horror stories all the time, brother. Like, I'm talking about patients who are having these big surgeries and basically in a closet in back of someone's office. Oh, bro.
Wow.
Bro, I'm telling you, it happens a lot.
Yeah.
And it's scary. Just because they can do something to you doesn't mean you should go through it. So I like you to kind of focus on, like, when did you start searching for a surgeon? Like, what did you look for, your experience of your surgeries, and then how we got to work together?
So my first surgery, I honestly had no idea of what I was getting myself into. I just looked for somebody that pretty much would do what I wanted them to do. That's the man side of me, and was not the smartest idea by far, because that resulted me in passing out, and a week later after surgery, having to go to the hospital, give 3 or 4 blood transfusions, be rushed to the hospital, scare the heck out of my family. Yes, they did that first surgery all in one time, and it was supposed to be 6 hours of surgery. It was 12.
12 hours of surgery, Pate.
12 hours of surgery.
Please tell me this was done in a hospital.
So it was done at a hospital, yes. It was done at a hospital.
Did you stay overnight?
No, that was one of the.
They sent you home.
They sent me home, and I didn't get blood work done before. I didn't know it was a thing. I had no idea. Nope. They brought me in. They checked me out and asked me questions. That was the version of checking me out. I just want to notate that. And said, "You're a healthy guy." Okay, cool. And we signed up, paid for it, showed up, did it. And I really didn't know it was a problem until I woke up, because I couldn't wake up. They had me in the recovery room. The lady was really just trying to get me out of there, because it was around the COVID time. So she was really trying to get me out the door. And the first thing I noticed is I was just kept drifting off to sleep. I just kept drifting off to sleep. And then they told me how long it was. And I'm like, well, what happened? And nobody could ever really tell me what happened. It's just, it just took a little bit longer. We got in there and, wanted to make sure everything was okay. Oh, okay. Right? Sounds like a great answer. Yeah, that apparently wasn't the truth. So I got home. Well, they rolled me out same day. My parents picked me up.
I just can't get over the 12-hour surgery, Mark. I forgot you telling me that.
Yeah, it was 12 hours of surgery, and my family picked me up. We got home. I was falling asleep on the way home in the vehicle. They were trying to keep me woke. We got to my house, stepped out of the truck. All I remember was them trying to pick me up, because I hit the ground. Boom. Hit the ground right at the house. And after that, I could only walk probably about 10 steps, and I would have to sit down, rest. 10 steps, sit down, rest. So we did that. We actually got me in the house, got some food in me. And for about a week, I was okay. But I started having these feelings of, like, just irritable and like something's not right. And I hadn't had a bowel movement. So I'm like, okay, maybe it's just because I hadn't had a bowel movement. So I got up to go to the restroom. My family helped me to the restroom. And all I remember was I started sweating. And I'm like, okay, I must really need to go to the bathroom. So I sat down, and that's when it all went dark. And I can remember hearing them, but not being able to say anything back to them. So it was a very scary time, because it was not a good thing to hear your family like, what's going on? They're panicking. And all you want to do is let them know you're there, but you just can't do it. And so they rushed me to the hospital that day. I remember getting in the ambulance, and I remember waking up at the hospital. The room was dark. Nobody was there. I was wet because, blood and everything was all over me. And I'm just like, what is going on? What happened? And so I'm calling for the nurse because I don't have a phone. I'm like, what's going on? I'm kind of panicking, and I'm trying not to panic. But yeah, so we did that. The nurse finally came in, told me what happened. My family brought my bag in because I said it's COVID time. Nobody could come in there. So they got me, they did a CT scan. And then the crazy thing about this was when I got there, they wouldn't let me eat because they wanted to do tests and all that. And I'm like, I really need some food. And they're like, no, can't give anything. I'm like, Jesus Christ. I'm like, this is going to get worse. So once they eventually got me upstairs and all they would give me was broth, then the doctor had to come in to say it was allowed for me to have food. Very, very scary time. I spent about a week at that hospital. And
how many transfusions?
4.
Man.
It was like, man, it was crazy, man. It was like I was living in a warp. It was like I woke up at the same time. I did the same things. They did the check every day, and they would tell me my blood level had dropped again. And I'm sitting there like, what is going on? Like, wow. What in the world is going on? So did that, prayed. That's actually where Determined Wellness came from, in that hospital. Because when I was there, a lot of people kept coming in like, man, you should write a book. They was like, you look great. You should write a book telling them about my journey, all that stuff like that. And I'm like, at that time, I was like, it's not what I'm trying to do with my life. Like, I'm good. I don't need anything else.
Get out of the hospital first.
Yeah. Like, it's like it's not what I'm focused on right now, but I appreciate it, So, so fast forward, I walked out of the hospital after that. So that was, it was definitely a time. But so fast forward after that, I did my first competition, all those things like that. I still had my chest skin, and my butt area had some sagging, and I was like, I'm not sure if I want to go through this again. But I knew from everything I learned that I definitely need to pick somebody that, one, had similar interests, and I could tell they really cared about what they did and they really know what they're doing. So when I met you, I came out to meet you. First thing I noticed about you is, okay, he's obviously fit, so he knows what I'm trying to achieve. It's the first thing. The second thing was, when I talked to you, you just made me feel at ease. I told you everything that happened to me, and you're like, you told me every reason of why it happened. And that was the one thing that changed I was like, okay, he knows exactly what he's talking about. And I kind of tested you a little bit, because I was like, so can we do this outpatient? You're like, no. I'm like, okay. So he definitely knows what he's talking about. So yeah, no, my surgery with you, night and day difference. I'll recommend anybody. I felt it was the smoothest process I've ever had.